Throughout history, tales of demonic possession have terrified and fascinated us. But what if these stories hide a psychological truth? Is it demons, or the mind itself, that's truly at play? Exploring the fine line between spiritual phenomena and psychological conditions, diving into cases like Anneliese Michel, and discussing dissociative identity disorder. Anneliese Michel's life was marked by her religious upbringing, the onset of her symptoms, and the chilling exorcisms that inspired movies like The Exorcism of Emily Rose. Her diagnosis of epilepsy and psychosis versus the belief in her demonic possession. 67 exorcisms over 10 months and the tragic outcome of her death from malnutrition. Was this a case of untreated mental illness or spiritual interference? Dissociative identity disorder is a complex mental health condition often linked to severe childhood trauma, characterized by two or more distinct personality states. DID isn't the same as split personality, nor does it involve supernatural forces. Symptoms include memory gaps, identity shifts, and varying levels of consciousness in different alters. Highlight how DID has sometimes been mistaken for possession, especially in cultures or contexts where mental health isn't well understood. The role of media in shaping public perceptions is significant. The Exorcism of Emily Rose dramatized Anneliese Michel's story. Split, a controversial depiction of DID, blending horror and misinformation. The impact of these portrayals, raising awareness but often perpetuating fear or misunderstanding. Stigma around mental health leads to misdiagnosis, fear, and discrimination. In some societies, symptoms of DID or other disorders are still seen as spiritual possession. How awareness can lead to better care and understanding. For alleged possessions, spiritual rituals or exorcisms are still performed in some traditions. But increasingly, professionals encourage psychological evaluations first. For DID, trauma-focused therapies, grounding techniques, and support systems are essential. Scientific advancements include studies on brain activity during dissociative episodes. Whether possession or disorder, these cases remind us of the human need to understand the unknown. What if the truth lies not in choosing between faith or science, but in embracing both with compassion and open minds? Encourage your audience to think critically and empathetically about these topics.